Just as there are several bathing techniques based on a resident's functioning and mobility, there are multiple methods for assisting residents with their bladder and bowel elimination. Toilet, bedpan, commode, incontinence briefs or pads, urinary catheter, urostomy, colostomy. Regardless of the method used, residents should be offered toileting assistance at least every 2 hours. The following slides provide an overview of each toileting method and when it may be implemented. The resident should be able to stand independently, walk, or pivot transfer with assistance. A mechanical lift that assists with bearing weight may also be used to place a resident on the toilet. Bedpans are used for residents who cannot bear weight or prefer to stay in bed, such as when having to urinate during the night. Residents who require a full body lift to transfer typically require the use of a bedpan. But there are also toileting slings to assist a fully dependent resident to use a toilet or commode. See the image of 2 types of bedpans. The image on the left is a standard bedpan, and the image on the right is called a fracture pan. Fracture bedpans are smaller than standard bedpans and have one flat end. They are designed for individuals recovering from a hip fracture or hip replacement. A commode looks like a toilet, but it is a movable device with a bucket underneath the seat. Commodes are typically placed near the bed for residents who have limited weight-bearing ability, do not want to share a bathroom with another resident, or have urge incontinence. Urge incontinence means that as soon as the person feels the need to empty their bladder, they have very little time before urine escapes. See the image of a commode. Incontinence briefs or pads are disposable products used for residents who have little to no control over bladder or bowel function and are worn in or in place of their underwear. A urinary catheter is a device placed into the bladder by a nurse using sterile technique that allows the urine to drain into a collection bag. Urinary catheters are used sparingly due to increased risk of urinary tract infections. Catheters are typically used for clients with urinary retention, have a wound near the perineal area that may become infected due to incontinence, or have a neurological condition that does not allow them to control their bladder function. See the image of an indwelling urinary catheter attached to a collection bag. Nursing assistants may assist in emptying/documenting urine output from the collection bag or providing catheter care according to agency policy. A urostomy is placed surgically to collect urine from the ureters when the bladder is diseased or has been removed. Urostomies are typically located on the lower right side of the abdomen, and urine is collected into a drainage bag. See the image of a urostomy. A colostomy is placed surgically when colon function is impaired. A piece of the colon is diverted to an artificial opening in the abdominal wall called a stoma, and feces is collected in a pouch. Nursing assistants must consider a resident's privacy and dignity when assisting with toileting just as they do with bathing. Most residents prefer to be alone when urinating or defecating. Privacy can be provided by closing the bathroom door if the resident is able to be left alone. If the resident is not safe to be left alone, close the door as much as possible while keeping the resident within eyesight. Maintain awareness of a resident who is toileting or on the bedpan, so they do not need to wait for assistance with perineal care after elimination and will not develop any skin issues from sitting on a hard surface. To maintain dignity, nurse aides should be careful when explaining and providing care related to toileting. For example, a disposable brief should never be referred to as a diaper. Acceptable terms include a brief, pad, liner, or disposable underwear. Additionally, a nurse aide should never show reluctance or appear burdened when providing toileting assistance, no matter how often a resident feels the need to be toileted or requires perennial care due to incontinence. Clients who are dependent on others for assistance with elimination should be taken to the bathroom or offered toileting options every 2 hours. Incontinence is a very personal matter and can be embarrassing for clients. Nursing assistants should use therapeutic communication when assisting clients with toileting.